the Association of American Physicians and Surgeons came out with a study on June 1st about masks. And this is mask facts. Now, I don't know why we didn't have this from the beginning, which we should have, but here it is. COVID-19, SARS-CoV-2, that particle is 0.125 micrometers. An influenza virus size is 0.08 micrometers. A human hair is about 150 micrometers. So remember that. So what they did is they looked at different masks, and there are many different studies. It's not just one study. So the data from the University of Illinois at Chicago, they looked at any N95 masks, and they said a properly fitted N95 will block about 95% of tiny air particles down to 0.3 micrometers from reaching the wearer's face. That's 0.3. How small is the COVID-19 particle? 0.125 micrometers. Let me continue. But even these have problems. A lot of these masks, the N95s, have to be fitted to your face. They went on to say that surgical masks are designed to protect patients from a surgeon's respiratory droplets and aren't effective at blocking particles smaller than 100 micrometers. So they went on to look at the cloth masks. All of the cloth masks and materials had near zero efficiency at 0.3 micrometers. Remember, COVID-19 is 0.125. The particles smaller than that easily penetrates into the lungs. Another study evaluated 44 masks, respirators, and other materials with similar methods and small aerosols. Medical masks, 55% efficiency. General masks, 38%. Handkerchiefs, 2%. One layer, 13%. 4 layers efficiency. Conclusion. Wearing masks will not reduce SARS-CoV-2. Why? Because the particles are too small. Cloth masks will be ineffective at preventing SARS-CoV-2 transmission, whether worn as a source control or as a personal protective equipment. In South Korea, they included a study of 4 patients. Patients who had SARS-CoV-2, they wore masks and coughed into a petri dish. Both surgical and cotton masks seemed to be ineffective in preventing the dissemination of SARS-CoV-2 from the coughs of patients with COVID-19 to the environment and external mask service. A 2011 randomized Australian clinical trial of standard medical surgical masks shows that they do not work. Medical masks offer no protection at all from influenza. And influenza, that particle is 0.08 compared to COVID, which is 0.125. So all of this doesn't work. And think about it. During the flu season, they would tell you everyone should wear a mask. This will protect you. But they know it doesn't. That's why they don't do it. Final thoughts, it says, surgical masks, loose fitting, they're designed to protect the patient from the doctor's respiratory droplets. The wearer is not protected from other airborne particles. This should be spread out everywhere, and everyone should remove their masks. It is doing absolutely nothing, according to the Association of American Physicians and Surgeons.